Hi, it's MDNetX again. Today we're going to talk about drugs. And no, not the illicit type, but pharmaceuticals. So, a fairly common thing we get asked is to analyze or find patients of a certain diagnosis, or at least providers treating patients of a certain type. So, we have here a heat map showing us the distribution and location of physicians who are treating Parkinson's disease. You may want to, or you probably are thinking and asking, how do you know who's treating Parkinson's disease? Diagnosis codes like ICD-10 codes, ICD-9 codes are somewhat difficult to come by, and for good reason. People have patient privacy concerns. The good news is that there are several large pharmaceutical prescribing databases. We have fairly extensive data on what providers are prescribing. What this lets us do is it lets us take a peek inside a practice, because knowing what a prescriber actually is prescribing, knowing what a physician is prescribing, we can see what they're treating. What's interesting about this is that in many cases, for example, in the case of Parkinson's disease, people sometimes assume that a certain specialty may handle a patient, but that's not the case. When we look at our database here, we can see that we have a very diverse population of prescribers dealing with Parkinson's disease, and you can see the claim count, which tells us how many prescriptions they're writing from. So obviously you see a lot of neurologists, but we see intermingling of psychiatry, neurology, internal medicine, geriatric medicine, and this kind of is sort of the one of the difficulties of medicine in the US is that we have a very fragmented, complex system. So it's not necessarily one person or one type of specialist treating a certain disorder, it's a variety. And this makes it a bit of a challenge. But by using this method, we can actually kind of take a look at how a physician or what a physician's practicing, and this gives us a better idea, sort of an idea of behavioral modeling of a physician. Another way of looking at this, we can take a look here at a physician who's prescribing a diverse amount of drugs, so typically an internist or some sort of generalist treating many diseases, versus a specialist who would have a less diverse prescription profile. So that's one of the things we do. If you have interest in this data or want to know more about it, please give us an email at the bottom. Thank you.